Hey guys, welcome back. Now let us look at the fifth, sixth and seventh steps in the pathogenesis of tuberculosis. The fifth step is called Th1 mediated macrophage activation and killing of bacteria. See guys, the Th1, which is nothing but a T helper type 1 cell, is produced from CD4 effector T cell. Okay, got it? CD4 effector T cell produces T helper type 1 cell. See, this cell, let me change the color for you. Now this cell in both lymph nodes and lungs. Okay, let me draw a cute lungs and lymph nodes. It produces something which is very important in this step, that is called the interferon gamma. Now you can't forget interferon gamma in the entire pathogenesis of tuberculosis. Got it? You have to remember this knight in shining armor. Okay, so interferon gamma has 4 jobs, okay? We'll remember all of them and they're pretty simple to remember also. Now, it basically activates macrophages, got it? That's what we need to do, and that's what the step also says, macrophage activation, and then we'll kill the bacteria. Interferon gamma is a dimeric, which is nothing but its dimer, and it's soluble cytokine, got it? Yeah, so it's dimeric soluble cytokine. Now, I told you the 4 steps, right? Let's remember them one by one. The first step is, it stimulates the maturation of phagolysosome. Now, what will this do? It will expose the bacteria, let's call these as the bacteria. It will expose these bacteria to acidic and oxidizing environment. Yeah, so let's talk about, the first step is over. It's just going to promote the maturation of phagolysosome. And obviously you know that lysosome contains many hydrolytic enzymes. Now, let's talk about the next step. Stimulates the expression of inducible nitric oxide synthase. Now this produces NO, obviously. Now NO combines with other oxidants and forms reactive nitrogen intermediates. Got it? See, it's all pretty simple. Now these are very important in obviously killing the bacteria. Now the third step is it mobilizes antimicrobial peptides. Now these people are giving it a fancy name, defensins. I think we completed 3. Now the last step is the 4th step. It stimulates autophagy. Now here they destroy the damaged cell organelles and also the intracellular bacteria such as the MTB. That's it. Let's talk about the 6th step in the pathogenesis, that is the granulomatous inflammation and tissue damage. You remember we activated the macrophages in the last step? Now these macrophages that are activated by this, remember the interferon gamma, which I told you never to forget. These differentiate into something called epithelioid histiocytes. Now, if they aggregate, they form granulomas. And if they fuse, they form giant cells. See, in this process, if it's a normal person, the pathogenesis, like the infection, stops here before any significant illness occurs. But if someone is immunosuppressed at advanced stage, the infection progresses. Also, the immune response causes caseous necrosis. Caseous necrosis is very important in tuberculosis. Do remember this. Also, you should remember, along with being differentiated, they also produce something called TNF, tumor necrosis factor, and chemokines. A little bit of pharmacology here. TNF antagonists are used for rheumatoid arthritis. Now, a patient who is taking TNF antagonist, who is a rheumatoid arthritis patient, the reactivation of TB increases. Now, that's it. We completed the 6th step and it was pretty easy, right? Let's come to the 7th step. It's super easy. It's called host susceptibility to the disease. See, whenever we think of host susceptibility, always remember immunosuppression. And when it comes to immunosuppression, we all know the first thing that comes to our mind is AIDS, right? It's the greatest risk factor for progression to active disease. And then glucocorticoids. Also, we just talked about TNF, right? TNF antagonists. Then transplants also carry some risk. Transplants, solid organ and stem cell. Okay, then we have something called, it's a very cute name, you should remember it. Mendelian susceptibility to mycobacterial disease. Yep, Mr. Mendel comes here too. So it's called Mendelian susceptibility to mycobacterial disease. Basically what happens is there are some inherited mutations which are basically rare, such as loss of IL-12 receptor or beta-1 protein. What they do is, we have something called MAC, that is Mycobacterium avium complex. It basically does, it's normally avirulent, it doesn't cause disease. Or the BCG vaccine that we take, that's also avirulent. But in these people with these rare inherited mutations, even these strains cause TB. And that is not just TB, it's severe TB. And this is called Mendelian susceptibility to mycobacterial disease. And with this, we complete our pathogenesis of tuberculosis.